Good evening, everyone. Thanks for joining in to the another Inspire series. And today we have Dr. Rashima, who was my faculty at Elite School of Optometry. Dr. Rashima did her bachelor's, master's, and PhD from Elite School affiliated with Spilani. She's been associated with Shankar Nethralaya over 2 decades, and she is the head of Occupational Optometry Services. She also handles as a teaching faculty at Elite School and Shankar Nethralaya Academy. Very happy and proud to have you at our Inspire series, ma'am. Thank you for our accepting our invitation. Today, she's going to talk about the role of optometrists, basically how it is important in occupational optometry, be it organized and non-organized or unorganized sectors. The screen time is yours, ma'am. Over to you, Dr. Rashima. Thank you so much.
First of all, thank you so much, Dr. Gopinath and Sharanya ma'am, for inviting me for the Inspire series. I'm very happy because you're doing something great for most of the students to learn from people or experts across the globe. You're connecting them with the students, and students are actually getting a lot of benefits out of this online series. I'm very, very happy, and I'm being a part of this Inspire series. So today we will be seeing something on what is it which is making the people, not to take the eye care services. So what are the reasons why people are not hesitant to get eye care services, and mainly in the unorganized sector workers. So I'll just share my screen. Is my screen visible and moving? Gopinath, is the screen visible and moving?
It's visible.
Now?
Just move to the next. Yeah, perfect.
Okay.
It's visible and moving.
So this is mainly to look at the barriers for eye care seeking behaviors among the unorganized sector workers, what we can do, and how do we play a major role in this. Okay. So before I start, I thought we'll have a small poll or question to the participants here. Whom do you think are the unorganized sector workers? Okay, maybe Gopi will help in running this poll now.
Yeah,
so whom do you think are the unorganized sector workers? Street vendors, or working in small scale industries, or agricultural workers, home-based workers. Whom do you think do come under unorganized sector workers? So most of them comment on street vendors, working in small scale industries. Any other choices? Home-based workers. I would be happy with all of you participate in this quiz just to know what you think about the unorganized sector, because the topic itself is on unorganized sector. So we wanted to know what is your opinion about unorganized sector. Okay. So most of you have thought that the street vendors come under, or the daily wages people will come under unorganized sector workers. I should say that all the four, which is listed over here, comes under unorganized sector. I'm very surprised to see that nobody has picked up agricultural workers coming under unorganized sector. I guess it is an unorganized sector worker. Okay, it is also an unorganized sector work. It doesn't come into organized sector at all. People who are working in very small scale industries like the BD making or matchstick making, all these also will come under an organized sector only, because a very limited number of people work over there, and there are many working groups which are like home-based. So like they do something like flower making, they do, we say kuda pentrathu, basket making, all this comes under an organized sector. So these people are the ones, should I share it again?
You can continue, ma'am.
So these people actually contribute to the 90 3% of the workforce in India. So majority of the workforce, the economy of India itself is dependent on these people, because unless these people are there, it doesn't go into the GDP of the country. Okay, so they have coverage of social security schemes, but which is very, very, very limited. And for them, they know very less about the eye care. Okay, so they don't take medical care as immediately as what we all think so. So if there is anything, they take it very light. Hmm? So what happens is, even visual impairment, even the uncorrected refractive error, which contributes the majority of the visual impairment, they do not take care of it, which means they're okay to live without their glasses. They continue their work. They do not see the importance of wearing spectacles. So it can actually decrease their productivity in their work, which they do not consider as such. So I'm going to ask you another question. What do you think about this image? There are different pictures which are lying over here. So what do you think about these images? Probably Gopi can actually help me in posting it. You can write whatever you thought about. What comes to your mind when you see this image? Will I be able to see the answers, Gopi?
Yeah, ma'am. As soon as they type in, yeah, we have not received any responses.
Everybody are thinking about what is it? Is it? What comes to your mind seeing this image? What do you think it is? No answers yet?
It is anonymous. You can type anything.
Yeah, you can. Your names doesn't matter.
Yeah. I have got one response. Yeah.
Mhm. I at least want few students to respond on it. There are different pictures here. So what do you think this is?
Please respond.
Yeah, Gopi mentioned that I was his faculty, so which means I am a teacher, so I wanted answers. Without answers, I will not move forward.
I have received 3 responses.
Good. So I literally have to threaten them. Please answer, because your answers will actually have some impact on the discussion which we are going to have. Because I need to know what you think about these people. So this image was taken in a campsite. I'm thankful to Ms. Janani, who's an occupational optometrist here. She has taken these images and made a collage of it. And I absolutely love this picture.
I have received 5 responses.
At least 10 responses. At least few more people responded. We wanted to know, what do you think? No more responses? You people are hearing me? Or my background noise? Okay. Let's see the responses then, Gopi.
Second, it is taking me out of zone. You please continue, ma'am. Once it is ready, I will
Okay.
wait. Sorry.
Okay, okay. So this image mainly looks at how people are utilizing their spectacles, which means they actually take it as a treasure, but see the pathetic state here, they're not able to afford to the spectacles. Okay, the condition of the spectacle is so poor. You see a lady here who's actually used a rubber band to fix the lens which has come out of the frame, and somebody has used a safety pin to just hook it, and it is something which is completely disfigured, and these people are still managing with it. Okay, so which means that they had, at this age, she has taken it for the first time, the examination. They have got old glasses which are secured with safety pins, threads, or taped together. It just shows that they have very limited access to eye care. And most of these people, if you see, are in the elderly age group. So which means they are looking at near vision as an important aspect. And that's the reason why they have gone for these spectacles. And near visual impairment is one which is very common with these people. So people over here are different sector workers. So one is doing a welding, another is actually doing a jewelry making. This is a construction worker, this is a farmer, and this is a weaver. So all these people are doing a task which are much, much different. All these comes under an organized sector. And look at the hazard which is there. If you look at these images, the person on to the top left is actually doing a welding. Definitely they are exposed to harmful UV radiation, and there is also a possibility of foreign body injury to him. And this is a construction worker, definitely fear of fall and also other ocular injuries from stone and other things is possible. Penetrating injuries are also possible with these people. Farmers, vegetative matter injury with the other things like farming materials are also very high with them. So if you look at these three people, it is not visually demanding, but they are exposed to a hazardous job. But look at the jewelry makers and the weavers, definitely both of them have visual needs because they have to look at these thread and this person has to look at the gem for fixing. So these two jobs are called as visually demanding jobs, and these jobs are called as visually hazardous jobs. So all these jobs needs an optometrist attention, and based on it, it is our duty to make sure that these people receive the appropriate pair of spectacles. But look at the literatures, what they say about eye care seeking behavior. So they say that availability and accessibility of eye care services is very limited. And that's the reason why there is a poor eye care seeking behavior. And people perceive disease in a different way. They think that cataract is common. So if I go for surgery, there is a possibility that my vision will go down. They never think that if the cataract has been extracted at the right time, the vision can be regained. So they never think about it. And the social demographic factors, like financially, they are very poor. They do not want to invest on eye care seeking there. Okay, and about definitely individuals' knowledge about the problems, what they have, even about wearing spectacles, whether it is good or bad, whatever they know about it has an impact on the eye care seeking behavior. These are listed down in literatures as the barriers which has been perceived for eye care seeking. So what we thought in our department is this is an unpublished data. I first of all thank the master student, Ms. Vidya, and her co-guide, Ms. Janani, for this work. We have actually designed a survey where we looked at what is the person's knowledge, attitude, and practice, and what are the barriers they have in eye care seeking. Okay, so we had their knowledge about the diseases. We have taken mainly the presbyopia as one condition, and we also looked at what are the potential risks at their workplace, whether they are aware of the healthcare schemes, whether they are not aware of the systemic illness which can actually cause eye health issues, and their perception about spectacles and wearing spectacles, and the barriers why they do not take up eye care services. So these were the questions which were listed down in the survey, and I'm going to list down few of the results from the survey. So perception on eye care, they think the blurred vision can be corrected with spectacles. So 80% of them feel that if there is a blurred vision, definitely spectacles would help. And surgery can also be helpful, thinking about cataract here. And they also said eating good food and proper medicines can actually correct blurred vision. So how do they think taking a tablet will actually correct blurred vision is not clear. diet actually is helpful, but it is not going to correct the blurred vision. So the perception they have about spectacles and surgery is different, but the information on diet and medication, we do not know. They say that children, if they take a proper diet, they need not wear, they will not get blurred vision at all. So they never have a concept called refractive error there. Okay? And many of them, almost 30% of them, had potential risk at their workplace. Like few were welders, few were agricultural farmers, and they know that they have potential risk at the workplace. They also know about the protective measures which are available for the ocular safety, almost 60%, but only 37% of these people were using protective measures, which means while welding, they are doing it bare, without any safety gears, which means this is going to be really difficult and it can actually go in for visual impairment later. We asked a question on the impact of spectacles in their workplace. So how do you think a person wearing a spectacle versus a person who is not wearing a spectacle? They think that a person wearing a spectacle means that their efficiency, the less work efficiency, okay? So the efficiency is poor over there. Almost 65% of the person thought about it. And few person said that they are not comfortable wearing spectacles at their workplace. And a few thought, if I would start wearing spectacles, there is a possibility that I might lose my job, because people think that I have poor vision and they might actually send me off from the job. So they don't wear spectacles at the workplace. And few thought, if I wear spectacles, opportunities for me is less, because they think that I cannot do it efficiently. So they might not give any other promotions or any other opportunities at my workplace. So I purposefully differ in wearing spectacles. These are different aspects on spectacles to be worn at the workplace. So I'm again asking you a question. What do you think are the reasons for poor eye care seeking behavior? So you would have seen different people in your hospital or the institutions wherever you're working. So what do you think are the reasons for poor eye care seeking behavior? I really need an answer for this, because otherwise there is no point in me just talking about it. I need some perceptions from your end as well. What do you think are the reasons why people do not take up eye care services?
First whole open-ended question, I have already added the answers, responses in the chat box. You can have a look.
Okay, okay. So people, poll responses is, okay, when you see the image, you thought it is a community eye checkup. Uneducated people wearing specs, they're so desperate for glasses that they're wearing even without, though they're damaged. Yes, that is what I was discussing with you people, though they're desperate for wearing glasses, but they are damaged and they do not have a financial thing for taking it corrected. So many people are still not have reached with the proper spectacles. Yes, old people are approaching for vision check when they are not able to see. Exactly. These were the things which I have also discussed. Most of them are elderly, which means when people go into the elderly age group, they think that their vision is important. They have to get their eyes checked. And most of them had glasses, but not in a proper condition. Yes. So I'm happy that the responses are improving now. But I need some more responses, at least few more people to respond. Even 1 point is sufficient for this question. What do you think are the reason for poor eye care seeking behavior among these people?
Chat box, one person have responded. Accessibility and affordability being the reason for
Yes, yes, accessibility and affordability, which is really an important aspect to be covered. So we have got 11 responses so far. Poll can be open for some more time.
yeah. I'll leave it open for some more time, yeah. But it might hinder your screen.
I'll minimize this and then I'll go ahead. you can actually drop down your information. So when in our study, we thought discussing with the experts, we got few information, and these are the barriers which we have received from the people who have participated in the study, of which time constraint, that they do not want to go leaving their work for eye care. Okay. And next is the financial constraint. If they go for eye examination, definitely they will ask for multiple tests, or sometimes they will ask to wear glasses where I don't have money to wear glasses, buy glasses. And the third point was it did not affect the routine life. So they felt I don't have any problem with my eye, and that's the reason why I don't have not gone for eye examination. It is not affecting my daily living, so it is not affecting my regular task or work. So why should I be going for eye examination? This was the third point, but that point actually hit us a lot. Why person with visual impairment did not feel that they need to wear glasses? It just hit us, which means the need for them wearing the glasses for their work was not in their mindset at all, which means they have not realized that if they have been wearing these glasses, their job performance would have been much better. So what they see now is, say, 618 vision, but with the refractive correction, their vision is 6.5. So they would have done it in a much better way. They would have actually seen it in a much better way. They do not have to strain for anything. All this, they have not felt it. Okay, so this was one which actually hit us, which means people should be aware what is it that is needed for them to have a good workplace without hindering or without having any eye strain or any headache or anything which is affecting them. So why do you think an optometrist should work towards this? So most of the jobs are visually demanding, and people have a lack of knowledge on usage of spectacles. So they do not know how to actually use it. Is it needed or not? That information is not there. People think using spectacle is a sign for poor vision. So as few of the patients said, if I wear spectacle, I might lose job. That's also there. And time versus productivity. So you need to be looking at few of the aspects where we can actually play a major role in this. And in ocular aspects, most of the jobs were hazardous and people have lack of knowledge on ocular safety. Wear eyes, it is easy to handle if I wear this, and on top of it, I wear safety spectacles, and on top of it, face shields. For welders, they think it is very difficult. So instead, if it is bad, I just need to pull out things which is needed for them. Cosmetically, they were not happy with the spectacles. And other health-related issues, they were not connected with the ocular aspects, which has to be looked at. Okay. Gopal, can we just see the poll results if it is
I have posted in the chat.
okay?
We have list of answers, almost more than 12 responses.
Perception of cost of service is still not giving importance to eye health. They think it's not much important. True. Lack of knowledge and awareness. Yes. Factors like cost, accessibility, lack of awareness. No time. So most of us don't have time for anything. The same way people also say in the unorganized sector, they said they don't have time. No one to accompany. That is also a reason with elderly. Cost. Cost is a major reason. Less education, so awareness. Most of you are talking about awareness and financial constraints. Yes, cultural belief. This is a secondary point which nobody has brought to us, but it is also an important point to be addressed. Fear of fuel, misconceptions and myths, right, about spectacles. Both days together, they may not get reduced visual acuity, but when it gets worse, yes. Uniocular visual impairment. So people have one eye, say 660 vision, and another eye, if they have 6.9 vision, they see that, I'm able to see everything clearly, so I didn't bother to check my eyes. They still don't bother about eye health compared to the heart health. Exactly. They think this is very important. This is not. They don't feel the impact of having damaged glasses, which will hamper their lifestyle. Very true. Metropolitan city, expenses, time, convenience. All of you have actually hit into that the thing that people look at time, money, and looking at why should I be doing it. Okay, so this is what productivity is the key here. So if you want to actually make these patients do start wearing glasses or do start going for an examination, is hitting at this word called productivity. So you have to talk to these patients stating that if you do not wear your glasses, you will be taking, say, a time of 5 minutes to complete a task. And if you wear glasses without eye strain, with a good clear vision, you will be able to do that task, say, in 3 minutes, which means for every task you're going to save 2 minutes in a day, which means like on a repeated task, you're going to actually save a lot of time, and it can actually put that across as a job productivity. So efficient working is possible when you have a good and clear vision. So you always hit onto the productivity aspect. They will understand it in a much better way, because for them, all these daily workers or the unorganized sector workers, if you always connect it with productivity, they will know it in a better way, and they feel that, yes, I have to get my eyes checked. So most of the people will come and tell us, now that I'm able to see everything very clearly with the new glasses, what you have given, so I wanted to come for an yearly examination to you again. So this is the difference which we have actually got into their work style. So this is what we wanted every one of you to take it in mind, that yes, time constraint is there, money constraint is there, everything is there, but if you make them to feel the need of wearing the glasses, a need for getting their eyes checked on a regular basis, they will come back to us. Okay. Yes. Vision and its impact at works. When you actually say that minor vision problem, so this is not going to hinder much with my productivity, you have to actually say, take off the smith and say, yes, whatever be the visual problem, it is minor or major, don't look at the severity as there, because it both actually have an impact on the productivity. So 20% workers with impaired vision may need additional time to complete the task. This has been proven. So which means that increasing their time to do it perfectly, instead of that, if you actually wear an aid like a spectacle or anything, which can actually give in a better clarity of work, this is going to be very helpful. So again, I just wanted to reiterate this. Not all the work needs 6/6. 6/6 is not the cutoff for all. Okay. If you say a goldsmith worker, he might be needing a 6/5 vision or an N5 vision. But if you look at somebody who is in, like say, welding, even 6/12 vision or say N8 is sufficient for him to look at the point and then do the welding. For the weavers, definitely they would need something like a 6/12 and N6, which is needed for them because they have to look at the yarns. So not everybody needs 6/6. Don't push everything like I told you to have a better clarity vision, so I have to push it to 6/6. It's not so. You need to know about what is the demand which the task is creating over the eye, correct it appropriately. So you don't need to force everyone to actually go in for 6/6 vision. So you need to know matching the visual efficiency to do the task very efficiently. So it improves the productivity, and also you should focus on ensuring the safety. So how do we proceed this? We need to know what type of work you're looking at. See, all of us are in a different sector here, right? So I'm in Chennai, where we see most of the street vendors and other small scale industries here. But somebody who is in Coimbatore would actually have a lot of weavers and agricultural workers, right? So somebody is in the belt of Tanjore, again, they will see more of agricultural workers. So you understand who is around me, who is actually needing the services, look at their work profile and start doing it. So start a task analysis. This is not going to take much of time and also no money involved in doing a task analysis. You just need to get their permission and see what they do. So once you understand what is their job, you will know how much is the vision which is contributing for the job to be done perfectly. So if this is known, it is easier for us to plan. Okay, so you can actually say that now that you are doing all these things, just give them a pep talk. So whenever you see a crowd of people who are working in a group, say home-based or something like an agriculture or anything, just go and give them a talk. They will definitely come back to you for eye examination. So reaching to them from our end. So instead of sitting within the four walls, it's better you step out and go to their community and give a talk to them. They'll come back to us. And then provide them a comprehensive examination, not at the cost as what you charge for your urban patients. So this, if you could actually do it as a service or take them a very bare minimum, a nominal cost from them, which is affordable for them, they do not hesitate to pay that. And if you could actually get some generous support for spectacles, because we can actually wean off our cost for examination, but for the spectacles, if they have to be spending, so even 300 rupees is going to be a large number for them. So if you could get some donors who could actually gather some money and give it to us for spending it on to the beneficiaries like this, your name will be put in good records, and there will be multiple other people who would actually combine or come together to support your initiative. So something you're doing to the community, going to the community and doing a good job to the community will always attract people, and there are people who are donors who would actually support your work. I mean, go in a positive note. Definitely, you will get some funding support as well. So just don't stop with prescribing spectacles. You should also be looking at the compliance assessment. So these are few of the examples of unorganized sector workers. These are mat weavers. These are rubber plantation workers. These are toy makers. And they're all small industries which, see, the industry may be huge. If you look at the rubber plantation, industry is huge, but the people who are working there are all like very limited earnings. Okay, they do have very limited earnings. So I was telling you about visually demanding and visually hazardous in job, but I wanted you to just focus on something called as task versus job. Task is what you do. If I ask you what is your job, you will say I'm an optometrist. But I'm not asking you that. I'm asking you what is your task in a daily task? What do I do? I will say that I'm seeing patients where I do vision check for the patients. I do retinoscopy. I also do slit lamp examination. I do the fundus evaluation using fundus cameras. And I also have to use computers to look at the medical records and things. These are the tasks which an optometrist do. Okay. So job is different, task is different. Why do I need to know about the task of a person? Because task only defines what is the visual demand it creates onto the person. Okay, so here you're seeing a person who is looking at the yarns and he's separating the yarns. Here, this person is sitting there and spinning the wheel just to make the threads put into the yarn there. Okay, so this is a person who is actually segregating these yarns into a small needles. And this lady is actually putting those needles into these yarns and making it a sari. Okay, so she is doing the complete weaving process here. So each person, if you ask what is your job, they'll say, I'm a weaver. But what do they do is entirely different. The demand which is created on this is not the same as this. Okay, so each job has a different visual demands. So this is what you should be understanding when you look at the task analysis. Again, I've been talking a lot, so I just wanted to ask you a question. How many of you know about safety prescription glasses? Have you heard about safety prescription glasses? Have you seen safety prescription glasses given to any of your patients on this? The answer is very simple. You have to either say yes or no. Good to know that a few people are not aware of safety prescription glasses. Most of you would have heard about safety glasses, like people in the building industries, they do just wear the safety glasses just to protect their eyes from the foreign body and things. Safety prescription glasses are a little different. Okay. So the prescription glasses means that it has the lenses. The lenses are ensures the safety standards and also has the prescription. So if a person is say -4 diopter, then you are giving them a safety glasses and asking them to wear the glasses, which means it is going to be 2 different glasses for them. it's going to be very, very tough. If you ask them to wear forcefully also, it is tough to actually handle that. So instead, what we have now is safety standard lens material, of which you can actually grind the prescriptions, which means you can have -4 diopter safety glasses incorporated in the safety frames. So this is going to sort out most of the problems in industries and also in small scale industries where you can actually go ahead with this. Okay, so these are sculptors. Okay, for sculptors are a little different. They are also visually demanding and hazardous because they are sculpting it and they are the ones who are looking at the perfection. Okay, symmetry is very important. Perfection of the figures is very important. Looking at the contrast is important. But at the time of sculpting, they're also exposed to sun, dust, which can actually harm their eyes. So we gave them the prescription safety eyewear. So what I told you is prescription safety eyewear. So this was very helpful because they're able to see clearly and also protect their eyes from the foreign body. This was very helpful for the sculptors. Definitely, these prescriptions, we will not give it in OPD because we do not know what the person's occupation is. We never even think about it, right? So in the toy making industry, we did a task analysis and understood this is how they are working. Their work environment itself is like this. So they are with bare eyes. They are not using any spectacles. And it is important they also have a good vision, right? So we gave them a safety eyewear. They were very happy with it. Even now in Chennai, people who are in the toy making industry started wearing safety eyewears and they look forward for us to come over there and do this examination for them. So whenever I talk about problems, we always look into the major ocular problems like cataract, diabetic retinopathy, glaucoma. But there are also other problems. Work-related problems are people are exposed to ocular injuries, eye strains, musculoskeletal disorders, and sleep disorders. So you must be thinking, as an optometrist, why should I be worried about person's sleep? If there is a sleep disorder, if there is a lack of sleep, it can actually affect their person's productivity at the next day. And it can also have impact on the eyes. It can actually disturb the person's eye health. They also have, if you look at the fundus of persons who are in the night shifts, you could see tortuous blood vessels because of lack of oxygen supply to the retina. We also had a World Health report on ocular injuries where people who had injuries at workplace, we have looked into it. We could see that many of them had injuries at the workplace. And if you ask them whether they were using personal protective equipments like goggles and things, only very few people reported that, yes, they were using PPEs. You know, if they are not using PPE, then the compensation to them is going to be very, very low when compared to persons who were using PPE at the workplace. PPE not only saves their eye and health, but also the compensation which is expected from the industry can also be deferred with and without PPE. When I say comprehensive examination, it is from the comprehensive history, knowing about what the occupation of the person, what tasks they do and things, till the examination of the fundus and dispensing them the glasses. Also, whenever you're going out, talking to community and things, have these awareness posters with you so that they will know that there is a lot to know about eye health and we have to be educating them wherever possible. So this lady, you could see that she's wearing a safety eyewear, but which is completely, cosmetically, it is not good. I accept it because this is very big for her face, but we could not get a smaller one for custom made for that person. Okay, we are trying to get it now. But this lady was still happy with the glasses because she said, now I'm not getting any dust fall into the eyes when I'm doing farming. Okay, I'm very happy with this. I do not go for farming without these glasses. This is a difference which we have created, and I feel that this can be done by many of us. And I'm just going to quickly go through what is happening with drivers. Most of the drivers do have visual impairment just for refractive correction, which means just wearing a refractive correction itself, the visual impairment that will come down. So which means these drivers have to be asked for how's their vision, whether they can be given a glasses or not. Okay. The referral rates are actually very less. Even the component what you look for is cataract and retinal pathology because the diabetes was only higher with them. So we gave them small stickers to just make them happy, feel that if their vision is good, if their vision was better than 6/12, we gave them a sticker saying that my eyes are fit. They were very happy with it. They said I came for an examination. I was given glasses, and I also have a sticker. I mean, the passengers are happy, saying that they are going with the driver who was visually fit. Okay, so these kind of small things which you could actually do it in your clinic will actually have a lot of impact. Okay, so we actually had a good media coverage. I'm telling you, this road safety month, January is the road safety month, and we are looking at more of driver's eye screening programs during this month. Okay, so we have one called as DESI, the Driver's Eye Health Screening Initiative through OATN, and there are 26 optometrists who have registered in this. If you people are unaware of this, please get in touch with the president of Optometric Association of Tamil Nadu, and all of us are a part of that association, and this will actually benefit the drivers at large. And if you have an optometric clinic, this will actually be a boost for your clinic to get advertised as well. People who are you interested to contribute to the DESI program, just to give me a thumbs up as yes or no. So maybe Gopi and Sharanya ma'am actually can get in touch with you people and see whether you can be contacted to get into this, enrolled into this program. I'm very happy to see that the maximum of few people are responding yes. So probably Gopi and Sharanya ma'am can actually share in more details about this to you, and you can actually be a part of this great initiative. All right. I'm very happy to say that with Acchutha Eye Care and Manipal College of Health Professionals, we did joint funding with the help of Optometry Confederation of India and Nethralaya Vision Foundation, mainly on farmers. This joint funding, we got a lot of information from the farmers. We were thinking that they are doing farming, we will just give them the classes. But look at the information what we have got. They said the spectacles now, insects will not hit them, no dust will be there, no dirt will hit them, no water splash. So this is very much needed for their eyes. She said, while I was doing a farming, I got hit with cow's tail, but because the spectacle was there, it did not hit my eye, so I'm safe. Otherwise, I would have lost my vision. And another person, he said, if a blind person gets vision, he'll be happy. Likewise, the act of you giving us a glasses is much appreciated. Don't you think that these kind of words and feedback is very much needed for any professionals to work for their profession, right? So these are the things which we are looking at. So a joint funding, if you could attach with an institution and do something for the benefit of the community is very much appreciated. So likewise, we have done for the salt span workers and fishermen and things, and just open your eyes wider, see which are the community who is by and large around you. If you could actually go and help them, that's going to be a lot of difference you're going to make it to this community people. So just don't stop with your clinical practice, ask some questions which is burning in these communities and try to give answers or solutions pertaining to eye care. Not only to eye care, if you could actually widen your perspective to as healthcare, it will be much appreciated. Thank you so much, and thanks Gopi and Sharanya ma'am for this opportunity, and I hope I have covered most of the questions which were asked in the poll box, which was opened by Gopi. And I take this opportunity to invite you people for EWOC 2025, which is going to be in 15th to 17th August 2025, and the abstract submissions and registrations are open. I would be very happy to see you people during EWOC at Chennai. Thank you, Gopi. And with this, I'm stopping my presentation. And I'm open for any questions.
If you have any questions, please feel free to post or unmute yourself and ask the question to Dr. Rashima directly. Sanya ma'am, do you have any comments?
I just actually have a question, Rashi. When we're looking at these different unorganized sectors and we're doing these vision screenings, so to speak, what is it that we have to really focus on? In case we're thinking in terms of publication, what are the things that we have to focus on? This is something one of the MOptom students was asking me.
Okay.
So-
That's a very good question, ma'am, because when you say about unorganized sector, these are the people who are like, it's a mix of population, right?
Right.
So we are not looking, if you are looking at a publication point of view, I would suggest that you take a defined group. Like what we did for farmers. Farming is a defined group of people. Likewise,
Right.
if you are looking at unorganized sector, by and large, if you take it everybody together, then it's going to be a mix of pool, then it goes into a general community. So if you're looking at occupational point of view, I would suggest that you define yourself to a specific group so that your
Right.
questions on occupational history can be more specific. For example, fishermen will have a different set of questions. Farming will have a different questions which has to be asked and things. So define your working community and then start your work. So discuss with these people first initially and then propose your methodology, then jumping into a methodology and then asking them the questions, because we do not know. We always think fishing is just an occupation.
Right.
Unless we go and see them, we do not know what are the things they are doing. Okay, when we went to the fishing community, we saw 5 different needles which they are using it. We were shocked. For prawns, it is different. 5 different needles they are using for just the net making. Okay. We were just thinking that it is simple fishing, but a lot of things are there. The amount of glare which they are exposed to, we will definitely not be able to accept that at all. We will not be able to stand there without our sunglasses. Right. So when we are not able to do it, their eyes are also the same thing. It's not much different. So we should also protect their eyes. So we started giving them photochromatic glasses. So understand that, do a need assessment first. Find your community, do a need assessment, then look for any study proposal which is possible.
Right. So the next question that the student was asking me before was, is it possible for me to talk to you, that is, to you, and see whether they can connect with you?
Anytime, anytime, not at all an issue. See, knowledge is just only for sharing. So
I'll actually, connect them with you, and then we'll take it from there.
Definitely. I've been helping many of the master students on, because I want this specialty to come up in a big way. So many
So I don't know if
students
Pranesh is there. Pranesh, are you there in the meeting at the moment? Because he was the one who was asking me these questions. Pranesh, are you there in the meeting at all?
Yes, ma'am.
Right. So, Pranesh, you can go ahead and connect with Rashima ma'am, and then we'll take it from there, okay?
Yes, ma'am.
Good.
Thank you.
We're happy to see that one person is interested in occupational optometry.
Well, we have quite a few people who have been asking us about, visual task analysis and how do we go about it and things like that. So, I'm at least happy that they're even talking visual task analysis and stuff like that. Couple of my BOptom students in their internship looked at construction workers and what visual task they looked at all the different sectors and said this is the visual task that is required, and so they had a few questions. So maybe I'll just connect all of them with you. We'll have a meeting at some point, and then
I'll see. I specifically did not cover on task analysis here because the topic was much different. So task analysis itself is
a whole
whole
lecture by itself.
Yes. So we will take different tasks and then we can actually measure what is the demand the task is actually putting onto the eyes and things. We can do it. Probably students can get connected and we can definitely work on that.
Yeah, because they've actually done some good work, because they've done video recordings of the peers to people doing the work, and they've come down back and sat and and they've done measurements at what distances, what is the range, and all those things.
Many of us, we also do a ruler and riba analysis, more like economic analysis also have been done by us. And most of the occupational health specialists actually look at us saying that I do not know how optometrists are doing all these things. They are
All
actually,
these things,
yes.
yeah.
I said we do not have any boundaries. We can actually go to any extent.
True, very true. So thank you so much. I mean, awesome. This is completely a different set of things that I think people should be aware of, because I think most of us just think of optometry as coming, doing your refractions, contact lenses,
Yes,
orthotics.
yes.
But
Beyond
there's
that,
so much more that we can do to create an impact in the community at large, where we are located. And I think that is how we are going to bring optometry, sort of the respectability and the accountability that we take in, right? That is what is going to propel optometry.
Yeah, I'll tell you something. People in the nook and corners of the villages know about dentists,
Very true.
but they do not know about optometrists.
No.
Okay, so I think they also did a challenge of going to community and did screenings.
Correct.
Okay, so we should also go out. If we do not go out and we sit in the four walls, nobody is going to know us.
No, notice what we are.
And never say that we are eye doctors. Don't
No.
say eye doctors.
No, no.
Say we are optometrists.
Amma. Very true.
That word actually should resonate, and people are looking at us, so they know now. They know we are not surgeons.
Yeah, very true. Very true. Very true. So thank you so much.
Eye care
Awesome work.
professionals, primary eye care professionals. That's fine.
Correct.
The term is not going to their ears. That's okay. We can make it as primary eye care professionals.
Correct. Very true. Very true.
Right.
I mean, awesome work that you're doing. Congratulations on the continued work that you're doing. We see a lot of your papers, a lot of the awards. Very, very happy to see all that, and the recognition to optometry that you're bringing in. Really appreciate that.
That is what I want every one of the students to actually bring in, because specialty of contact lenses, low vision, binocular vision has reached its peak.
It's reached its peak. So I think
now you need to actually go into other wide angles. Okay, see, occupational optometry has contact lenses, has binocular vision, has low vision also into it. So this is a specialty on its own. Explore it much, how much ever you can.
Very true. Very true. Anyway, thank you.
Thank you so much for the opportunity. I hope people have taken it.
Yeah. So if you guys want to listen back to Dr. Rashima's talk, we will again upload the recordings in the YouTube channel. Listen to it later time. And I take this opportunity to thank Dr. Rashima for spending your time and sharing your inspiring knowledge. We'll meet you guys in another Inspire series. Thank you so much. Thank you, everybody.
Thank you.